Hello, friends. Dr. Rahul Kamat here once again for you on this channel, Arsa Medica, the dedicated medical astrology channel. Now, the last video I did was about maybe a couple of months ago with the interview of James Braha. I got a good feedback on that, and it was a refreshing change from the kind of work that I was doing in the past on this channel. I have also been thinking about making some changes in the format of the presentations, because they tended to follow a very similar kind of a medical astrological analysis, say, of a case, say diabetes mellitus, or let's say somebody with heart disease, for example, or things like that. I thought that maybe a conceptually different format might be refreshing, and I could do a little bit of some more deep dive in medical astrological concepts, also a sort of a research oriented deep dive approach. So today I am back in a way refreshed, and I am planning to do this in a slightly different way. What I'll be doing is I'll be giving you the larger context of the case in the beginning, and then we will directly work with the Kundali itself in the software with a screen sharing. Okay, so those of you who are Jyotishis or who are seriously doing some advanced Jyotish will be able to follow this, and that's the way it will be, because making a lot of slides of each of the findings is going to be very cumbersome and complicated. Okay, so here goes. So basically, let me start sharing the thing now. Now here, you can see what this is about. I call it the medical astrology special because this is something we've not done before. The idea was to really pinpoint the disease in terms of its location and in terms of how it would have emerged in the tissues. So a heart attack, for example, would have a different causation. A cancer would have a very different causation. Can that be seen? Can that be explored astrologically? And how does actually disease progress in a sense of the pathogenesis? So that's the concept of it. Today, we are discussing a case of amyotrophic lateral sclerosis. This is the medical diagnosis. Basically, it's a very progressive neurological degeneration disorder or disease. There is a degeneration continuously of nerves and muscle. In this, the cause of this is unknown. It suddenly strikes somebody at any age, and it can lead to a death within 2 to 5 years of diagnosis. And basically what happens is that this person loses control over neurological functioning. It can be functioning of, of muscles of the limbs, or even breathing muscles, eventually respiratory paralysis kind of situation, and trunk muscles. And it's a kind of a very painful and very, very undesirable sort of a disease to have, and there is no cure known so far. Now, why really do we do medical astrology? As you know, I'm a medical doctor. I'm an allopathic medical doctor, and I have a Jyotish Visharad also. And medical astrology, therefore, naturally is a sort of a calling for me, which combines my prior background as an allopathic doctor and my background as a Jyotish professional. So what kind of a thing could we really expect from medical astrology? I mean, to dissect a disease after it's done is fine, but could we know this in advance or early? I think that is the holy grail of medical astrology. If we know that there is a disease possibility, that if we can actually accurately predict that this individual is going to have, let's say, after 10 years, a particular disease, if we could accurately predict. And I believe I have made some progress in that direction in terms of advanced predictions. Then could upayas prevent or alleviate the disease? So that's really the question here. And we will see here how that works in this chart. And also, how do we understand this disease from the lens, or from the looking glass, as it were, of medical astrology? Because how do we understand, let's say, a kidney failure which causes retention of fluid in the body, which causes electrolyte imbalances, let's say, which actually results from a failure of the filtration mechanism of the kidney, say, allopathically speaking. How do you correlate that with what actually is caused by the grahas or by the astrological factors, So how could we do that? And then how can then we build a bridge from Jyotish to allopathy, okay, which then can help us to either know in advance the disease, then so we can try to give a upaya which can work alongside the medical treatment, or if we could know it in the early part of the disease, let's say stage 1 early onset cancer, if we know the factors involved, then the upayas can prevent or at least could help along with the allopathic treatment to sort of reduce the intensity of the disease potentially. Now, that having said, my next slide is more important, which talks about the disclaimer that I am a medical doctor, and basically I certainly and primarily believe in allopathic medicine or modern medicine, and medical astrology is a developing empirical kind of a science or methodology which tries to combine Vedic and also Neo-Vedic. When I say Neo-Vedic, I mean the outer planets also included in the analysis, as well as concepts of Ayurveda, which find echoes in the Rashis, for example, and also Western astrology. So that's the thing. So basically, it's a disclaimer which sort of protects me in a way. Now, what is the astrological approach today? So what we'll be doing is, and probably this is the last slide. In fact, this is the last slide before we get into the Kundali. There will be no summarizing slides, as I already told you. So this basically is a deep dive in the 6, 8, 12 houses, which we will do, which are basically the houses of, the disease traditionally what we study. Their lords and their dispositors. When I say dispositors, we are going to do a really deep dive. So in terms of, we will be following the Parashari system. Okay, so there is no Krishnamurti Paddhati or anything like that I'm using. I'm using pure Parashar Jyotish. We'll also be looking at the significators of that disease, which is not written here, but we'll be also looking at the significators of a particular kind of disease, and we'll also see if those significators and the dispositors match or there is a correlation, obviously. We will be using the Rashi Kundali or the primary D1 chart, of course, and for the divisional charts, mainly we will be looking at D3 and D9. D3 for localization, and D9 for the qualitative deeper insights into D2, D1, in terms of how the grahas collaborate with each other for health or disease. I have been able to use D3 with a lot of insight, although when we read the medical astrology books or what is available as a student material, one finds that there are so many different possible ways of looking at Dreshkan for medical astrology and all that. There is a Varahamihira approach, and there is a generalized another approach. But I have been able to use the Parashari definition of D3 and really get some good astounding results. We'll also be looking at the nakshatra deity in the pathogenesis of disease. Now, this is something which is very close to my heart. I have recorded a few videos of about nakshatra deities, already in my channel. For example, we've discussed Varuna, we've discussed Indragni, the deity of Vishakha. We've discussed Agni, of course, the deity of Kritika, and Varuna, the deity of Shatabhishak, for example, and among other things. Now, the deity, the nakshatra deity has a singular effect, in my understanding, on the pathogenesis of disease, and it represents some kind of a deep regulator of the disease process. Like, what is the inner engine of the disease actual happening? What we call um, the womb of the disease process, if I may use that terminology. That is how I relate to it. And I have been, again, I'm not very sure about it. This is some kind of an exploration, as I said, and I'll be sharing my findings from a real chart. So maybe this is an area which needs more work. And correlation of astrological findings, of course, with clinical findings, because I know this case well. So I will be able to also correlate that. And here we are not looking at dasha. Okay, we are looking only at the natal chart, essentially. And based on the natal chart, the divisional charts which emanate therefrom. Okay, now that having said, I think now I'll stop this share and, try to share with you now now you see this, right? Now this is the chart you see in front of you. And now we are directly getting into the meat of the lecture now. So SK, on the left side, you see the name SK is obviously the initials of the name. I would like the name to be anonymous. This was a patient who consulted me in 2021, early 2021. The symptoms started in January of 2020, and the patient expired around 16th April of 2021. So that's the history. And basically there was progressive neuromuscular weakness, starting with, left hand and right leg, and progressed, and then could not speak, choking. Eventually, there was choking, and, because of the respiratory muscle paralysis, and also urinary incontinence happened. And there were some other symptoms in terms of pain in the legs and in the hips and, in the toes and everything. So very, very, as I said, a very sad situation. But we will now look at it from the medical astrological perspective. Now, this is a Leo ascendant, as you can see. Okay. And Mars is in the ascendant. Okay. Mars is in Purva Falguni, which is a Venus nakshatra. Okay. Now, remember, Purva Falguni is also Ugra nakshatra. Okay. It is a Venus nakshatra. It's a Ugra nakshatra, and Mars is in Leo, which is a sign of the sun. Okay. Again, a malefic in terms of Jyotish, but we will not read too much into that right now. Just we will be with what we are seeing. Now, obviously, Mars is the Raja Yoga Karak planet here for the Leo ascendant. It is in the Lagna. Point to note. Fair enough. Now, let's just do a sort of initial hygiene kind of thing. So we look at the moon, sun, and the ascendant. Okay, and then we will go into the deep dive. Now, the moon here, and we will come to the moon again, but just immediately notice that the moon is in the 9th house in Aries. It is towards the very end of Aries. It's at 29 degrees 21 minutes of Aries in the Kritika nakshatra. Okay, obviously it is the first pada of Kritika nakshatra, and it is therefore it is the Sagittarius Navamaush. So we will come to that. It's a fiery Navamaush, moon in Kritika. Just remember this, and then we will correlate it later. You will realize what I'm talking. Now, the sun is exactly opposite. So this lady was probably born, I would say closer to the Purnima or the full moon, since the moon and the sun are sort of separated almost, but possibly it could be one tithi after Purnima, possibly. So it could be the waning moon, possibly, since the moon degrees are more than 13 degrees, 33 minutes of the sun. Sun is here debilitated in the 3rd house in Libra. Okay, and in Swati. Now, Swati nakshatra, the deity is Vayu, nakshatra Swami Rahu, sun in Rahu's nakshatra. Well, not exactly the best situation. Also here debilitated. Also in the which house is this? This is the 3rd house. So Lagnesh is sun, debilitated in the third house of this chart. Okay, in a Rahu's nakshatra, with very close to Venus. So Venus sort of combust situation possibly. And also Sun and Ketu are together, but they are in a different navamsha and a different nakshatra, so not too much of a problem. But basically, it shows that the ascendant is debilitated in a way. Okay, and that really doesn't augur that much well, and that too not in a good house from the medical astrology perspective, because as we know, the third house is the Bhavat Bhavam house of the eighth house. Okay, now, so this is a very broad thing first. Now let's get into our core business, which is that of medical astrology, and for that we have to go to the, let's say, the sixth house. Now, my experience of having seen almost 100 charts for medical astrological consultations has been that the sixth house always, and always, the story begins with the sixth house, always. Okay, so essentially from there it gets connected to everything else. It might not, sometimes the connections are not very obvious, but there will always be a source connection from the sixth house. So let's look at the sixth house here, which is Capricorn. Here Lord is Saturn. Saturn is retrograde. It is in Pisces. Okay, in a sense it's a Viprit Yoga situation, but it is in Pisces. It is in the nakshatra of Purva Bhadrapada, and the first, now look here, now here we are, it's at 0 degrees 10 minutes of Pisces in the nakshatra Purva Bhadrapada. Now here is where we slightly study this in a different way. What Dreshkan is Saturn in? Okay, Saturn is in the first Dreshkan of Pisces, okay, which is Pisces itself. Okay, so you will find Saturn is in, if you see here, now I am opening the D3 chart here, Saturn will be essentially in Pisces again, and again the position is not good, it is in the 8th house. Okay, so when you say Pisces Dreshkan Saturn, which is the Shashtesh here, Pisces Dreshkan would indicate the feet. Okay, the ankle, ankle ahead of the ankle, your main tendon, that is the tendocalcaneus, the thick part of the, below the leg, and then the leg, the toes itself, and leg and the toe, foot and the toe, sorry. So it indicates that there will be problems in that area here, some kind of a fibrosis, restriction and all. Now this patient did have problems. There was fibrosis, restriction, the toes could not be easily moved, so the Saturn somewhere contributed. Now Saturn, what does Saturn do? Saturn takes away the juice, it restricts, it creates fibrosis, it is a constraining influence, it is a chronic, it is a disease of, it is a graha of chronicity. Okay, so it is a long-standing thing, it is not something immediate and acute. It will be long-standing pain and restriction and that kind of thing. Now let's look at the nature of this affliction. How do we study the nature of the affliction? We have to therefore for that go to the Navamaush Kundali. Okay, so obviously if you see the Navamaush Kundali, it is the first Navamaush of Pisces, which will be obviously Karka or Cancer. So Saturn is in Cancer Navamaush. Of course, we don't need to check, but for the sake of this thing, I'm opening it here. You see Saturn is in Cancer Navamaush, obviously, here in the D9 chart. Now, what kind of a Rashi? Now, here we need to look at the nature. When we say nature of that Rashi in the D9, what is the nature? So in the D1, it is watery because of course Pisces. And in the D9, again, it is watery because of Cancer. And it is a Chara sort of a changing Rashi. Chara Rashi, Jala Tattva. Okay, so it's a cardinal sign, or Chara Rashi, and water element, Jala Tattva. Okay, in D1, it appears to be dual nature because it is, Dviswabhav, as we call it. cardinal fixed or mutable as we call it in English. Okay, and again watery. So the watery part is very clear. So here there you see when you say watery, what does it indicate? It indicates tissues are oozing some fluid outside. There is a watery atmosphere and there is also fibrosis. So what causes fibrosis? What causes restrictive thing and watery? So this is the inflammation. This is a chronic inflammation. Okay, medically speaking, it is a chronic inflammation, which is when there is a chronic inflammation, there is inflammation also, there is fibrosis, there is restriction, plus there is also fluid which is being pushed out, and therefore a watery environment, and there was swelling in the toes. So this is the correlatory thing. Now, Saturn is in which nakshatra? It is the nakshatra of Purva Bhadrapad. Now, Purva Bhadrapad again is considered to be a Ugra nakshatra. Okay, and what is the nakshatra Swami? Of course, is Jupiter here. But nakshatra deity kya hai? Nakshatra deity here is Aja Ekapad. Is the deity called Aja Ekapad. Okay, so Aja Ekapada is a kind of a Shiva. It's a ferocious form of Shiva who stands on one leg. So Ekapada, it is a Rudra. So it is one of the Rudra forms of Shiva. Shiva means auspicious in Hindu. In Hindu meaning, the Hindu meaning of Shiva is auspicious. It's a Sanskrit word, but the original deity is Rudra, or the original power is, or the force of nature is Rudra, and this is a kind of a ferocious form of Rudra. And when you say Rudra, Rudra is a combination of Agni Tattva and Vayu Tattva. So therefore, you can imagine Agni Tattva, Vayu Tattva, again inflammation, again some kind of a Vayu Tattva here would mean fleeting pain kind of situation. And the Ekapada, which also means somebody standing on one leg, also indicates the leg part somewhere, leg part. Okay, and no wonder this is in Pisces. Okay, the nakshatra is actually partly in Pisces and partly in or rather it is 3/4 in Aquarius and 1/4 in Pisces. So it is indicative of the leg part. You know, the pillar, the leg which acts like a pillar. So possibly this is more than symbolic, and it tells us the nature of the disease. Okay, so I will proceed from here. You are getting the sense of what I'm doing now, correct? Now, if you look at now the 6th house, the 8th house. Now the 8th house here is Pisces. Okay, itself, like we discussed. Now, we discussed about the position of the 6th lord in the 8th, so we will not go over that again. Now the 8th lord, okay, the 8th house is important. It's the house of disease, the house of longevity, or how longevity can get reduced, or affectations to longevity. Now, Jupiter here is in the lord of the 6th house is in the 12th house. Now, this again becomes another Viparit sort of yoke situation, and Jupiter here is exalted in Cancer in Pushya, and it is relatively close to its exaltation point. I mean, about 5 degrees. And Pushya being a, Pushya is where Jupiter thrives. Okay, as you know, nakshatra Swami of Pushya is Jupiter, but nakshatra Devata is Brihaspati. So Jupiter is at home there. And again, now if you look at the what Dreshkan is Jupiter. What Dreshkan is Jupiter in? Jupiter is in the 2nd Dreshkan. Okay, it's in the 2nd Dreshkan of Cancer, which is therefore Scorpio. So you have a Jupiter in Scorpio. Now Scorpio would indicate what? Which part of the body? Scorpio would indicate the area below the umbilicus. It would indicate the urinary bladder kind of thing area. It would indicate the lower back. It would indicate the lower part of the urinary system, as in the bladder, as I said, and also the lower back, if we look at it from the external part of the body. So, and you see that, so that is one part of it. Now, if you see D9, what do you see? Of course, we've already seen Saturn and how it is placed, but now you also see Jupiter. Now, Jupiter is with Rahu. Jupiter is with Rahu in the same norm house with Rahu. Okay, in Libra. Okay, so here Jupiter is less comfortable in a Venusian sign than Rahu, because Rahu is, after all, Swarabhanu, disciple of Shukracharya. So Rahu is more comfortable, more at ease in Libra than Jupiter possibly. Jupiter is therefore gets influenced by Rahu. So therefore, the pure Jupiter in Pushya, the exalted Jupiter you see in the D1, you see the real picture is slightly different. It is affected by Rahu. Okay, and you find that it is not really it is having, of course, it is having a protective ninth or seventh aspect on the Lagna in D9. Okay, but it really is not having any aspect on the sixth lord. If it had aspect on Saturn, it would have been protective, but it doesn't have aspect on Saturn. And in fact, it even and it does have an aspect. It does have an aspect, however, on the Sun, which is the Lagnesh. So to some extent, Sun is protected by Jupiter. But again, as I said, Jupiter is polluted by Rahu. Sun also in D1, if you notice, is again, in a sense, in Swati, therefore, influence of Rahu debilitated. So therefore, even this protective influence is not really helping too much. Okay. Now, Pushya. Okay. Now, Pushya nakshatra basically, is auspicious nakshatra, and it actually indicates, in a sense, that the situation could improve a bit, because Jupiter is in a good position in the D9, as I said. Okay, but then again, because of Rahu, there could be some growths. There could be a tendency for some kind of a growth to happen, like a small neoplasm. Maybe it could be benign, but nevertheless, so that needs to be watched. Okay, although this lady had no history of any growths, let me say this. Also, Jupiter has a ninth aspect on Saturn here, as well as a seventh aspect on the sixth house. So in that sense, Jupiter is a slightly better planet for her, clearly. Now, when we have done this 6 at 12, we have to also look at now the 11th house immediately, because 11th house is the Bhavat Bhavam of the 6th house. Okay, so now the 11th house here is, if you see the chart here, this is Gemini here, and you have Gulika sitting there. Gulika is very much sitting there, and Gulika is in the last navamaush of Mithun. Okay, so what is the last navamaush of Mithun? So the last navamaush of Mithun is again Mithun itself, or Gemini. So you see Gulika is in Gemini navamaush. Okay, so if you see D9 now, you see Gulika is in Gemini, like I just said, with Neptune. Now this is creating a problem, a very big problem. This is the source of possibly the bad luck that this lady faced, because Gulika is with Neptune. Neptune is actually Varuna, and Varuna in Neo-Vedic astrology, Varuna basically is a malefic type of influence in medical astrology. You see a lot of cases of unexplained illness, because remember, Varuna is also the nakshatra deity of Shatabhishak, and Shatabhishak nakshatra indicates diseases which happen because of no reason, and diseases which disappear because of no reason, or healings which can happen spontaneously. Like somebody is having disease and suddenly it goes into remission or heals, or somebody has no disease and suddenly it comes into existence. So therefore, Varuna with Gulika is pretty bad. So that's one, and this is in the 11th house, which is the Bhavat Bhavam of the 6th house. Okay, so therefore it indicates disease. Now, what else is looking at Gulika? So if you see Gulika, now Gulika is in the 12th position of the 6th lord in D9. This is important. It's in the Vyayasthana from Saturn. If Saturn is in Cancer, Gulika is in Gemini. So that is something which is not really good. Okay, now the lord of this 11th house, lord of Gemini is Mercury. Mercury is with Mars in the 6th house. Bad. Mercury is strong in Virgo in Mars, but it is strong in Virgo in 6th house, but it is polluted by Mars. Mars, now look here, Mars here in this chart, of course, is the Raja Yoga Karak planet, but Mars is in the Lagna. Okay, so Mars is kind of ravaging the Lagna in a sense. There is a pressure on the Lagna there, and Mercury is the Marakesh, the Dvitiyesh. The second lord is Mercury in the D1 chart. So that the Marakesh and the Lagnesh are together in the 6th house. Not good at all. Okay, and okay, the only you can say the redeeming factor, if at all, is that Jupiter has a 9th aspect on Gulik here in the 3rd house. But again, as I said, Jupiter position in the D1 chart is not good, and it is qualitatively compromised in the D9 because of its proximity with Rahu. So this was one immediate analysis. Now, important thing to understand is that I mean, like I said, I think we need to do the Jupiter analysis a little deeper because we just seen the Dreshkan part. Now the Jupiter in the D9 is in Libra. Okay, is in Libra D9, is in Libra Navamaush. Now Libra is a Chara Rashi. Okay, so it's a kind of a cardinal sign. That means symptoms keep on constantly changing symptoms. Okay, here again it is a Chara Rashi. So see, look here. In D1 again, Cancer is a Chara Rashi. So it is Chara Jala Tattva. And in D9, it is Chara Vayu Tattva. So Jala Tattva, Vayu Tattva, which means what? Swelling and pain. Swelling and pain. Swelling because of water retention and pain. And where? In Scorpio, the Rishkana, which means possibly urinary bladder, retention of water, painful urination, that kind of situation possibly, and it matches because she had those symptoms. Okay, so this is very important. So this is a point which I had forgotten to make, which I am now making. Okay, now from the 11th house, we were looking at the lord of the 11th house, which is Mercury. Now Mercury here is in D1, it is in Scorpio. Okay, it is in Scorpio in D1. Now Scorpio is a Sthira Rashi Jala Tattva. Sthira Jala Tattva, and Mercury represents again earth element. Remember, earth element, Sthira Jala Tattva. And then if you see now the D9, Mercury is again, as I said, Mercury, I already said it is in Virgo. Again, it is in trouble because of the Mars, let's say, contamination. But that again is Dviswabhav and Prithvi Tattva. Okay, so this is Dviswabhav, this is Sthira Jala Tattva, this is Dviswabhav Prithvi Tattva. So so what does it indicate? See, Mercury is the significator also of neurological of nerves, basically, in the human body. Mercury also stands for intercellular communication. It also stands for the fluid passing between the cells and the extracellular space in the human body. So you have fluid inside the cells, which is called the intracellular fluid. You have fluid outside the cells, which is called the extracellular fluid. Any disturbance in this creates swelling and things like that. Now, this signaling between these intracellular and extracellular spaces is governed by Mercury. Okay, so Mercury is a mischievous planet. In the Kalapurush Kundali, it is lord of the 3rd and the sixth house. Remember, it's the natural sixth lord of the Kalapurush Kundali. So therefore, Mercury also creates a situation wherein this particular person loses control. Now the Dreshkan part, Mercury again is in Scorpio Dreshkan, in nakshatra of Anuradha. Okay, so Scorpio Dreshkan means what? Again, which part of the body? The urinary bladder here. We already seen that the urinary bladder is already affected heavily, because of our discussion earlier with Jupiter. And this corroborates because then the urinary bladder has lost its control. It is losing control in a way. So here the Prithvi Tattva would indicate the muscles of the bladder, because the muscles are Prithvi Tattva, which are called the detrusor muscles of the urinary bladder. And the Jala Tattva, of course, is indicated by the urine there. Okay. And in the D9, this is Prithvi Tattva. So again, Prithvi Tattva, Jala Tattva, and the Dreshkan matches. Okay. So therefore, this is something to note. Now, which nakshatra is Mercury in? Mercury is in the nakshatra of Anuradha. Anuradha, the nakshatra deity is Mitra. Okay. Now, Mitra is a form of sun in a way, but Mitra also has a connection with Varuna. So the same, let's say, celestial force during the day is called Mitra, during the night is called Varuna, in the evening is called Varuna. So it's a Varuna Mitra combination in the Rig Veda, which is spoken about. That having said, Mitra indicates the fire element in the form of the supportive fire of the sun, if I may say so. Okay. Now, here, Mercury has afflicted, in a sense, Mercury is affected by the Mitra. So somewhere, since Mercury is disease producing graha, being the 11th lord, it's you can say the signaling which needs a fire element of some kind, some electrical impulses, something that is affected because of the Mitra influence here. So that is my way of correlating the nakshatra deity here. Again, as I said, it is very complicated. This sort of corroborates with this clinical findings. That's why I have the courage to talk about it here. But this needs a lot more research than what I have done so far, and I want to be doing that in the future. So this was about that part. Now let's go to the third house. Third house is the Bhava of the 8th house. Third house merits proper study. When you look at the third house here in the Kundali, you see quickly Venus and Sun in practically they are not in the same Navam house. You see, Venus and Sun in both in Swati, but they are not in the same Navam house because the Navam house has just changed. Okay, so in that sense, that's slightly better because the Venus is in Libra, then which in own house, and then it in D9 it becomes Venus in Capricorn. Okay, so here you see that Lagnesh is weak. I already spoke about that. Lagnesh indicates immunity also. It indicates a sort of a less fire element. The fire element being affected. And we are repeatedly seeing that kind of a thing, if you notice. The Lagnesh is sun, which is a fire element. It is debilitated. We already spoke about that. Now the moon. Now here, interestingly, I want to now sort of, no, before I go to the moon, let us complete the sun thing. Now, sun here is in which Dreshkan? It is in the second Dreshkan of Libra, which is again Aquarius. Remember, it is an Aquarius Dreshkan. Aquarius would indicate the thigh, not the thigh, sorry, the calf muscles. Okay, so therefore, the calf muscles here would be weak. They would have less sort of, one can see that sort of affectation. And you see Venus also in that same Dreshkan. So Venus and Sun will be in the same. And remember, and look here, you have Gulika here with Venus and Sun. Okay, surprise, surprise, or shock, shock. Gulika is spoiling the party here as well, because Gulika and with Venus and Sun in Aquarius Dreshkan would mean what? Would mean that it is, because Gulika is Shani Putra. It is more vicious than Saturn. Saturn and Sun are not at all friendly. So they are enemy planets together, with the inflammatory Shukracharya or Venus sitting there, because Venus also stands for inflammation, in a sense. So this becomes like a inflammation of the arteries also, possibly in the calf region, because the Sun stands for the blood vessels. The Venus stands for the inflammation, and Gulika would stand for some kind of a post-inflammation restrictive fibrosis, because again Gulika acts a little bit like Saturn. It is Shani Putra after all. Okay, so now this is very important. So therefore, we see these patterns. She had problems with her calves. She couldn't walk. She was actually relegated to the wheelchair. And in early 2021, February onwards, her condition really deteriorated and she passed. Now, the thing here is that what kind of a mind did this person have? Because there is a mind-body continuum. The mind reflects, or the mind influences the kind of a body, body reactions or the disease. Also, we have what we call holistic way of looking at the mind-body connection. So here, mind or moon, or the emotional part of the mind, which is the moon, is in the last Trishkan of the last Navamsha of Aries, which is Sagittarius, and it is also in the Sagittarius Dreshkan, correct? Because it is 29 degrees 21 minutes of Aries. So the last Dreshkan of Aries is Sagittarius, fiery. Again Sagittarius would basically be about the the pelvis region, the hips. So she had painful hips for sure, which is corroborated by clinical findings. Now, if you look at the moon here, moon in D1 is Chara and Agni Tattva. Okay, if you see if you see the in the D9, it will be Dviswabhav, or dual kind of a thing. See, moon will be in here. Moon will be in Sagittarius, as I said. It will be Dviswabhav. So it will have two kinds of emanations in a way. And again, it is fiery. So here, so there is a lot, and moon is pain. Moon stands for emotional kind of thing. So this was very, very, very painful type of, and in Dreshkan, of course, it is in Sagittarius Dreshkan here. Moon in Dreshkan, if you see, it is with Mars and everything, Rahu and all. So it's a whole cocktail there sitting in Sagittarius in D3. So therefore, there is a lot of pain. There is some swelling sometimes. There is some kind of inflammation and pain which keeps on going all the time and coming, going, that kind of a situation you often see with this thing. And again, the Nakshatra Devata, now if you look at the Nakshatra Devata perspective, this is Agni. Kritika, the Nakshatra Devata is Agni. Remember, Nakshatra Swami is Sun, the Nakshatra Devata is Agni. Now, Agni and Kritika means that which cuts, in a way, which is cutting. So you see something which keeps on cutting her, internally. She's in constant pain. She doesn't want this to last. And if you see the position in D9, of course, you see the mind is the mind is actually also, moon is with Uranus. Now we consider, as I said in Neo-Vedic Jyotish, we look at Uranus, Neptune and Pluto. Uranus indicates some suddenness. Uranus indicates also something to do with the electrical impulses. Also, in a way, Uranus can be looked upon as a higher octave of Mercury in that context. So therefore, Uranus moon would mean that she had this kind of, not exactly epilepsy, but this kind of acute neuronal discharges, which created severe pain. She became almost kind of uncontrollable pain, like paroxysms of pain, if I may say so. And then suddenly they would subside. So you see that again and again happening, and again, it is the moon is affected by Mars in D9 by its fourth aspect. Mars is not only spoiling Mercury here, but it is also Mars, and Mars, remember, is Lagnesh in D9. Lagnesh is spoiling, is affecting the sixth house with Mercury there, and it is also having a fourth aspect on the moon, and the eighth aspect on its own self. On its own self, as in on the ascendant where the Ketu is sitting. So you have a Mars Ketu sort of influence on the ascendant because of the eighth aspect of Mars. So therefore, ascendant would mean the whole body or the whole well-being, and the moon would mean the emotional mind, and therefore the painful mind, as it were. Now, a couple of things I want to, say. So I think I've spoken a lot about this. So I think this correlates, as you can see, it correlates a lot. What we have been just doing is D1, D3, D9, and nakshatra devata. I don't want to get into many more things here. For example, we could look at the Jaimini. So we could just do a few things. What we could do is we could look at significators. So obviously, in this case, you have weakness of muscle and you have nerve degeneration. Nerve degeneration significator is Mercury. We already saw here that Mercury is affected in many ways here. Is creating a problem. But again, it's always a complicated situation. You have Mercury with the Saturn situation here. And then you have muscles. Muscles, what happens in muscles? Muscles are indicated by Mars. Mars is certainly affected, and muscles become fibrosed, restricted, all that. That is again Saturn. You have edema, you have retention of water. Again, that is again the watery part. So we have done a lot of things. I think this does correlate quite well, I must say. Okay, although I'm saying it myself. But I hope that if you are with me thus far, you will appreciate what I have done. Okay. Now, I think with this, what the last thing we can do before we go in is, here is, basically look at the Jaimini Jnati Karak. So what is the Jaimini Jnati Karak? So I can just have a look here. My Jaimini Jnati Karak is Mercury. No wonder. This was this is amyotrophic lateral sclerosis, a progressive neurological disorder. The main significator is Mercury. So we arrive at the same point correctly. But to arrive at Mercury from this chart, it at first glance, it appears Mercury is in good shape, fourth house, okay. But when you need to arrive at it through the analysis of the 6 at 12, here our access to Mercury as the primary, as one of the main planets is through the 11th house, for example. But again, as I said, medical astrology is not simplistic. It's not always a question of one graha. It's always a collaborative effort, to take down somebody's health. Okay. So with this, I will stop this sharing. And what I will do is now I will share my, share the presentation again, the last part. So this we've done. And finally, the last slide, thanking you for your interest. If you like, please subscribe. And please write comments. If you wish to consult me, write a comment in the YouTube below, and leave your email ID maybe, and I will contact you or something like that. Okay. And I want to leave you with 2 thoughts here. One is, of course, a tribute to the wise physician, as in Homer's epic poem Iliad. He says the wise physician skilled our wounds to heal is more than armies for the common weal. Okay, I'm sure the soldiers who are dying on several global battlefields today will realize the value of this statement. And secondly, the second point, which is very important, I feel, is by Hippocrates, who is the father of modern medicine in a way. And we have the Hippocratic oath, which every doctor has to take at the time of his passing out. He says that a physician without knowledge of astrology has no right to call himself a physician. Now, that's a bold statement. Then what happened to astrology over the years? Somehow it was it was disregarded. It was, it was relegated to some kind of a superstitious category, and it was not properly integrated. So I think it's time to now integrate astrology, uh, as you call it in the Western system, or Jyotish as we call it in the Hindu or Vedic, post-Vedic system, and with Ayurveda, which again is a Vedanga, and therefore create a more comprehensive knowledge and comprehensive understanding of health and disease. Thank you so much. This is Dr. Rahul Kamat signing off. As I said, it's a very different format today, but I think much more insightful if you are with me so far. Thank you so much. Goodbye. And, I will see you next time. Bye. And if you like my channel, please like, share, and subscribe.